Thank you, Rinki. A good evening to everybody joining us for CII IWN's Need of the Hour. And this evening with us, we have Dr. Vipul Gupta. Dr. Vipul Gupta is a homeopathic physician and consultant. He's actually really a renowned homeopath. And he's also been my personal homeopath. And Dr. Gupta, it is indeed a privilege and a pleasure to have you on our platform this evening. A warm welcome to you, Dr. Gupta.
Thank you, Bhavna. It's been a privilege. Thank you for inviting me to this session. I would love to answer all your queries and give you a brief about whatever little we understand about COVID.
Awesome, Doc. Thank you so much. So, Doc, I'm actually just going to start right up. We've been hearing so much about COVID, and we really want your perspective, as a homeopath. How do we view COVID? What's your take on COVID?
Yeah, Bhavna. So basically what you need to understand is before we go into the homeopathic aspect of it, there are a few facts about COVID or SARS-CoV-2 as we all know it.
Yeah.
There are a few facts which we need to understand before we move ahead and start talking about the treatment protocols, the homeopathic point of views, the allopathic point of views. So there is a brief understanding. I know a lot of you must have heard it by now. But just that I have been reading about it a lot, so just wanted to give you a brief about that. So basically, as we all know and we all understand, COVID is a viral illness. Now, the important part which very few people know or may not have understood the whole thing is, now this COVID thing is actually two parts of COVID are there. One is the viremia stage or the viral multiplication stage in which the COVID multiplies. Now that basically is a stage which starts from day 1 when you catch on to a COVID infection and it normally lasts up till day 4, day 5. So that is the time when a lot of people feel that, oh, it's a routine viral illness, there is no problem, they have a mild cough, probably a fever, somebody may have a high grade fever, say around 101, but the symptoms are not alarming. Well, that is like any other routine flu as we have all known over the years, influenza flu. Till then, it's like the same. Now the change comes in from 5th day onwards, which is when the whole hell breaks loose in few people, not all, but in few people. That is when I have started coining the word business end of COVID, or you can say the real shock of COVID, is when the body starts mounting an immune response against this virus, which we have commonly known as a cytokine shower or a cytokine storm, is when the real problem comes in. Now, this cytokine storm or a cytokine shower, which is basically certain antibodies are getting produced by our body, which starts recognizing this virus, but it also starts causing inflammation in various body organs, namely your lung as being the primary one.
Yeah, absolutely.
So that is when the real problem starts in. So the real inflammation starts in there. Now, a lot of people feel that, oh, it is a pneumonia. But what I want a lot of people to understand is actually they have forgotten, if they see the CT scans, it is always written atypical pneumonia. Now, this atypical word is very significant because it's actually not like a lung, like a bacterial pneumonia, which we all know of. In October or August of last year, the Italian scientist had done a biopsy of a lung tissue of a fatal case of COVID, and they found out that actually what was happening was there was clots which were developed in the lungs. These clots are what basically cause that shadowing, which looks like a pneumonic patch. Now that clotting which is happening is what is causing the lung tissue to get solidified and the oxygen exchange starts reducing. Now a lot of people also feel that our oxygen is fine, so our lung is normal. That is also not true. The problem is that normally, even if our 50% of the lung is functional, we can still maintain an oxygen level of normal 98, 99.
You don't even get to know.
We don't even get to know. Correct. So a lot of people feel that, oh, our oxygen is fine, we don't have to worry. But the problem is that once the oxygen starts falling, that basically means nearly 2/3 of your lung is getting involved now.
Right.
which is when the problem starts resurfacing, and that is when the real problem starts in and the oxygen starts falling, and then it becomes very difficult for us to control that stage. So what I'm here trying to emphasize here, which a lot of people don't understand, is don't wait for that situation.
Yeah.
That is the real problem. So post fifth day, if your fever is persisting, if you are still having difficulty in having a cough, if you still feel that your body ache is persisting, then be on the alert. Then that means the cytokine shower has started. That means that the problem has started. Don't wait for the oxygen levels to come down and then start acting on that.
Right. Is there a minimum that you would say as a threshold though?
So normally, the moment the oxygen starts reaching around the 95, 94 mark, we know things are going awry now.
Yeah.
Because a normal individual maintains a level of 95 to 99 as a routine.
Yeah.
And there is one more thing which Bhavna through your this channel I want to also tell you is about the use of pulse oximeters.
Yes,
Unfortunately, a lot of people I have seen do not understand pulse oximeters. I will just tell you, it's a joke, but it is a fact that at night at around 2:30 at night, a month back, I received a call stating from an individual saying that my oxygen level is 36.
Okay.
Now what did I reply? I said, throw this oximeter into the dustbin and go off to sleep. So what I'm trying to explain is that people go into this panic mode of not understanding that oximeters have to be used, that whenever they put it, they need time for it to stabilize. Their pulse has to stabilize, their oxygen has to be monitored, and once it comes to that stable level is when they have to check.
Absolutely.
So a lot of people don't even understand that part. So what I was telling you about this thing is that the moment the pneumonia comes in, the atypical pneumonia comes in, and the oxygen starts dropping, that means 2/3 of your lung is getting involved now. Now, the moment that happens, then we are in trouble. So the best time to basically seek attention is obviously the first stage, which is the 1 to 5th stage. So then the doctor is constantly monitoring you. Or if you want to wait, then if beyond the 5th day, the fever is persisting, then please contact your doctors, because then the problem would start.
Absolutely, Doc. No, you're absolutely right. So Doc, now I'm just gonna, would you like to share any more, or shall I just start with a couple of questions?
You can start now. Basically, I've given you a brief overview about what, and the reason I told you this is that a lot of people ask me individually. So I just wanted to put it in this, that this is how we understand COVID. And the understanding of COVID is so important that once we start understanding it, then obviously any form of treatment we have to offer. I am not talking about homeopathy because that is my area of specialization, but even any other physician, if he has to attempt, has to understands this is the background, and then we treat it.
No, absolutely, Doc, and thank you for walking us through that. It's been very, very helpful. So, Doc, I'm just going to ask you, because there's a lot of talk around, for prevention. Everybody's saying take camphor, take arsenic album. Is there any legitimacy to this? Is there any truth to this?
So, unfortunately, Bhavna, what you need to understand is that a preventive medication comes into existence through studies.
Yeah,
it comes into existence through a lot of work going in. Don't mind my saying this, but a preventive medicine cannot come as a brainwave to somebody sitting in the room with AC on and think that I have discovered a preventive.
Right.
Preventive always comes with lots of study, lots and lots of hard work, lots of symptom noting, lot of work. And the surprising part for me was that the moment COVID was discovered in March, in April people started putting preventives.
Yeah.
I would put myself, and I would say that I am not a great learner, but I was trying to read, and it took me 3-4 months to understand the disease.
Yeah, absolutely.
And people came up with preventives in 1 month.
So there's no evidence around it.
Absolutely no evidence. There is absolutely no evidence around it. There is no evidence about camphora, arsenic albums. And the problem is that the non-medicos, the people who don't even understand homeopathy, were coming up with the preventives.
That's
Well, that is the irony of the
yeah.
situation, and the point is that for any preventive to be effective, you will
Yeah.
have to have some percentage of people getting helped by it.
Absolutely.
Just because you have to take a preventive doesn't mean that you take anything which is available. Now people used to come back and tell me, Bhavna, that oh, there is no harm. So my
Yeah.
reply was that the grass growing outside your house also has no harm, take it.
I love you, Doc. You're like, you just blow it, to pieces. You're like,
Absolutely.
I'm not supporting
People
it.
come and say that, oh, there is no harm, this is homeopathy. So I answer
Yeah.
that, then why are we taking it? There has to be
Yeah.
some concrete evidence to prove that that particular medicine has any efficacious level to prevent or at least control the serious disease.
No, absolutely. I'm so glad you said that, Doc, because, there's so much going around and every day we keep getting, WhatsApp University is really terrible university.
That is exactly the point. So that's what I always explain all my patients, that please don't run after these preventives. There is no validation of these preventives. There is no study which has gone on to basically come up with these preventives. Simply on the basis of just a person thinking that this is a preventive doesn't work like this.
No, thank you, Doc.
And the worst part, Bhavna, is that I don't want to elaborate on a specific individual, but what has happened is, suppose somebody gives you a preventive, then the worst part is you get complacent.
Yeah.
And
Absolutely.
that is the basic problem. And that is what happened to a lot of people, that people started distributing it among their factory workers and people like those, and they got complacent and the entire factory had to be shut down.
Yeah, they didn't take the right precautions because they became complacent.
Because they thought that, oh, they have had the preventive, COVID will not hit them. So that is something which we need to be really beware about, and we need to be careful about, because what you need to understand is that as a doctor, if it is coming from me, it has to have a validation. It has to have some proving. If somebody comes back and says that, why the hell are you giving the preventive? I should have this white paper in front of me, that this is the white paper, and based on that, I am giving you a preventive.
No, you're absolutely right, Doc. I think that's brilliant. Absolutely. Very well said, Doc. So, Doc, I'm just going to ask you about two more medicines, which again are floating around, and you can just, reduce them, or if you think they're valid. So one is Justitia for cough, and the other is Asphodosperma for increasing O2. Is that, what do you think about that?
So I will explain you both these things. So what you need to understand is that in homeopathy, basically, a lot of medicines are there for dry cough. Lots of medicines are also there to improve upon the various problems related to COVID and even otherwise. So Justitia and Asphodosperma are two such medicines which are there. But if you ask me that whether any case taking Asphodosperma, the oxygen is going to increase, the answer is absolute no. Absolute no. So it is completely wrong on us to basically come up with one medicine for all cases. It's like asking me, does one shoe made by Nike fit all the individuals in this world?
Okay.
How is it possible? How is it possible to have a situation like this? So similarly for Justitia as well, it's a drug which we use very commonly, not only for COVID, for even otherwise, and we have been using it for many years now. And it is a very effective drug for a particular type of dry cough with some throat irritation and some irritation in the upper part of the chest. So it does help, and we use it very, very regularly. But whether every case of post-COVID cough or COVID cough will be helped by Justitia, the answer is absolutely no.
Yeah, absolutely. No, I think that's very good. And in fact, I'm just going to say this here right now for everybody who's joining us. I know we take audience questions. So those who will be writing their questions, can you please write your questions in bullet form and be pretty concise and make your symptoms known? Because if Doc has to answer your specific questions, he's got to know a little bit about you. Yeah. Okay. So Doc, now I'm going to cover the post-COVID, the recovery phase, because one, we know there is long COVID. Two, everybody's having different symptoms from breathlessness to body ache to cough to joint pains to headaches to low grade fever. Doc, is there, I mean, what can we do?
So I will, as you have rightly said, all individuals are manifesting with various degrees, severities, and types of symptoms post-COVID. Typically, the COVID post-COVID phase is a phase between 2 to 8 weeks, not 2 to 4 weeks. It's 2 to 8 weeks. So I am
the acute phase.
The phase of post-COVID is starting from post-COVID is starting from 2 weeks to 8 weeks. So up to 8 weeks, the people are manifesting with symptoms related to the primary COVID illness, which they had 8 weeks or 6 weeks back.
Right.
So basically, again, as you have rightly said, all individuals are different and everybody responds differently and has a different group of symptoms. So they are medicines 110%, and we are doing it now that actually God has been kind to us and the cases have reduced. The post-COVID cases are massive. So every day I am doing at least 20 to 25 cases of post-COVID on a video call with various degrees of symptoms, as you have rightly said, being from dry cough to throat irritation, to chest congestions, to body pains, to lethargies, headaches, eye pains. And one very typical symptom which I want to tell you, Bhavna, is what COVID also does is it brings the weakest area of your body symptoms to your forefront. So just before your interview, I was talking to one of the patients who had a sacroiliac 7 years back, which I had treated. And she had
what does that mean?
A sacroiliac pain is a back pain. Is a sacroiliac joint is a back pain, a severe inflammation of the sacroiliac joint. So she had 7 years back, and now post-COVID that is resurfaced, which is not. This is not something which I am finding with this particular patient. With a lot of my patients, that their old earlier symptoms which were there, like one kid who just now was kid as an 18-year-old. She had COVID, and I treated her for otitis media, for ear infection around 5 years back, has resurfaced, and the infection of ear has come back in such a massive way.
Wow.
So that is another symptom of post-COVID scenario, is that body's weakest area, body's most vulnerable area, body's area which had healed but was slightly weak, is coming up, is presenting post-COVID in a lot of patients. So based on the symptoms, based on the individual problems and a proper diagnosis, we have lots to offer for patients, COVID and specifically post-COVID.
Right. Okay. Brilliant, Doc. So, Doc, I'm now going to just jump to audience questions. I have one quick question, Doc. We did touch upon the fibrosis. Is there any way to prevent it?
What you need to understand is that, as I was touching upon the fact that there is clotting which happens. So once the clotting heals, the lungs goes into fibrosed mode. And when we say fibrosed, it's basically the shrinkage of that lung tissue. So once the lungs start shrinking up, there is decrease of the oxygen carbon dioxide exchange which starts happening, leading to a reduction in the oxygen levels in our bloodstream. So basically what we do is, once we recognize that there is an issue like this, there is a medicine which we use in homeopathy which specifically addresses this fibrosis tissue. We call it pulmonary fibrosis. Now that we understand that it is a post or a COVID symptom, we use it, and we have been able to maintain a lot of people with this particular situation by not letting it enter into a severe stage of fibrosis. Having said that, Bhavna, what you need to understand is we are basically catering to mild and moderate cases. Please understand, and very clearly all your viewers needs to understand that the moment the case starts turning into a moderate to severe, then the best approach is to go to the hospital. And now with the hospital beds available and everything, don't risk your lives. We are not here to help you post a particular stage. And every doctor, even if somebody has to understand, needs to understand the limitation and work accordingly. We cannot be treating every case who comes to us. We need to individualize, understand, and take a call according to the patient, whether this patient is fit to stay at home and be treated, or whether he needs to be shifted to a hospital and be taken under a hospital care.
No, I think that's very true. I think, it's like there are different tools for different timings, and you have to use them
And
judiciously.
you have to individualize, and the timing is very important there, Bhavna, because if your timing is incorrect and you wait too long, then the situation gets very tricky for us. So we need to make sure that if we feel that things are not moving right, and within 2-3 days I sense that the patient is not going in the right direction, then we have to advise them to get admitted. There is no other way to save a life, because at the end of the day, it's not about homeopathy, allopathy, Ayurveda. It is about saving a patient's life.
Every life matters, Doc. It's so true. What you're saying is absolutely right. It's not about the system, it's just about saving lives.
Correct.
We're going to start with audience questions now, Doc. From Rinky, post-COVID, I have been having mild fever every day in the evening. Also, I get headaches. What should I do? Can you please give some medicines?
So what basically, Rinky, you need to understand is post-COVID, having a mild fever is an indication of a mild inflammation persisting in your lung. So we have faced this symptom a lot with our patients, specifically post-COVID. In homeopathy, there are specific medicines to address that. If you have an associated cough or a congestion also, then a medicine by the name of Drosera 30 is really helpful in controlling the cough, as well as helping you to control the low-grade fever and bringing down the inflammation of the lung. But if you don't have any such symptom, then a medicine like a Gelsemium 30 is found to be really effective in controlling this low-grade fever. If you take it thrice a day for a week, it will help. But I cannot overemphasize this point as well, that taking adequate rest and letting your body heal is also a very important aspect of it. I just want to add here, Bhavna, one more thing, that I don't think intake of too much of supplements are helping, and that is what my personal view is. Although I have seen a lot of my colleagues prescribing a lot of supplements, but I, as a personal, and after seeing so many patients, feel that too much of supplement may be counterproductive.
No, I agree. I mean, there's so much debate around it. So I think, vitamins.
That is my personal experience. I have seen so many patients, and I have basically understood that by giving so much supplements is not helping. So two medicines, Rinky, again, I'll repeat, Drosera if you have a cough, and if you don't, and if you only have low-grade fever, then a Gelsemium 30 is helpful.
Drosera was also 30, by the way, the potency.
Yes, Drosera 30, yes, please.
Yeah. So, okay, we've already covered Sonali's on Aspergillus. Glossy is asking, what would you recommend for healthcare workers to prevent a severe infection? Again, we go back to the question.
Glossy, what we need to understand is, if you come to us at an early stage of viremia, as I was explaining you in the first half of our conversation, that is the stage I am able to help a lot of patients. Basically, there is a standard protocol we have started for our COVID patients, specifically in the first stage of disease, as the viremia stage. So as I was just now mentioning about the Gelsemium, so there are 3 medicines which we are using for the first stage by the name of Gelsemium, Hippelsulf and Yelbasanta. If you use these 3 medicines in coordination 4 times a day for a period of 5 days, what we have found is that we have been able to prevent, and we have statistics with us now, around 80% people who have not translated from this viremia stage to a stage of a severe infection. Lot of people argue about the fact that the viremia stage can also be helped by itself. That is true. But what we have found is, in families, when we have given this combination and certain people have elected not to take them, they have gone to the viremia, the cytokine storm stage, and we have been able to help people who have taken this particular medicine. So over the period of last 6-8 months of my experience tells me that this particular combination is really helping for me and my patient to basically prevent the severe infection from coming.
Okay, so in a time,
but that has to be taken at stage 1. Don't, if once the cytokine storm shower comes in, then this medicine is not going to be effective.
Yeah, absolutely. From Sonali, we got how can homeopathy help in pre or post COVID? Pre, we know it can't. Post, obviously, Post we'll address, should we address it symptomatically as people bring it on?
Address it symptomatically, again, depends upon what type of symptoms. If just now Rinki asked me about the low grade fever. So again, based on what symptoms are you experiencing, based on that is when we decide how to tackle with that particular case, how to help him to the best of our ability and ensure that his symptoms are relieved and he comes out of it with minimal damage or no damage.
Awesome, Doc. Thank you. So, Doc, we've got from Rinki also asking another question. Can you recommend regular homeopathic medicines which one can take to increase immunity? Like, is there some?
Now, through your media, Bhavna, I want to make people understand that immunity is not a name of a solution which you can put it in water and drink it and your immunity will get boosted. People need to understand that immunity is not something which is like a bird which you can eat and immunity grows in your system. Immunity,
not one day.
And not on one day, and it is not something which is like a thing. Immunity is your body's ability to fight disease, and every organ may have a different set of immunity. So a lung may have a weak immunity and your stomach may have a strong immunity. So what will you call yourself, a weak immunity guy or a strong immunity guy?
Very well said, Doc. Very, amazing perspective. Very well.
So what you need to understand is that once we have to first outline what exactly do we need. Do we need something to basically help in regards to helping a particular body organ? That's one. And if you are asking me if there is a body immunity medicine to prevent COVID from happening, the answer is already been given. There is none.
Yeah, correct.
So this thing of people coming to me asking me for various immunity medicines is absolutely wrong, because there is no such thing as immunity. Has to be individual things. So a lot of people come to me pre-COVID era, I'm talking about in pre-COVID era, a lot of people come to me that I have a tendency to sinusitis. So that means that they have a tendency to sinusitis and I will treat it. So I will, if you want to understand it in other words, I am improving the immunity of their sinus tendency.
Absolutely.
So you will have to be very, very categorical and understanding that this immunity word, and that is why I feel that this brainless use of supplements which people are doing is wrong, because I feel too much of the supplement intake may have had repercussions now or later on in your life, is what I fear. And yesterday only I was reading an article about the use of zinc associated with mucormycosis, the black fungus, as we have been hearing a lot. So I am actually worried, and I have been telling in various forums about this, that I am worried that the amount of people, and I have seen people having Zincovates and A to Zs and all these things for months, and 2 to 3 tablets a day. So I feel that would have some repercussions on our system, is what my fear would be.
Yeah. So Doc, actually, I hope it's not building any, reverse toxicity. Okay, Doc, thanks so much. From Shibani, actually, this is a question from Dr. Alok Chopra. Do you have a specific treatment for black fungus?
So mucormycosis, as we call it, what you need to understand is mucormycosis is not something which is humankind. As COVID, we have known only from 2019 and 20. Right. Mucormycosis has been known to medical science for many years.
Right.
So mucormycosis is not something like a new phenomena. It has been something which has been with us, and we have studied in our books, in our literature over the years. When I was becoming a medical student, I used to study in my books about mucormycosis. Right. But the problem, which is why now it has become like epidemic proportion, is the use of steroids and the use of, and having people having diabetes. This combination in so many people have led to the intense use of mucormycosis. So just now somebody was asking me that why in US also there was a lot of use of steroids, why has mucormycosis not spread there? So the difference between US and India is the regulated and unregulated use of steroids. In India, the problem came that one prescription by a learned doctor was given to one individual, and that prescription was circulated in groups.
Yeah, that's terrible. The sharing of prescriptions is horrible.
Prescription is the primary problem, because if a person or an individual does not need a steroid, or if he's a diabetic, and if you give him such a high growth steroid, your sugar is going to go northwards, and that is what the problem came up. So the unregulated use of steroids led to this thing. Now the second part of the question, whether homeopathy can help. So I will answer that query also, that there are certain telltale signs about mucormycosis which you need to understand. If you recognize it in time, and if you come to us in the initial stage, then I am the person, I can help you with that. So the basic signs is sinus pains. So typically the sinus pains, right? The nasal blockages, the discharge from the nose being any color other than the white and yellow, and black dot starts appearing, is the stage when we fear that the mucous mycosis may be growing. So in the initial stage, if we are able to address it, first diagnose it and then treat it, yes, it is possible through homeopathy to treat it. But if it gets late, then I would suggest you need to rush to the hospital. That amphotericin B, the medicine which is been uniformly used, needs to be used. And God forbid, if it has gone beyond that stage, then an ENT has to step in and he has to do a surgical intervention. That becomes problematic, yes.
Yeah, we heard horror stories about where somebody's had to, cut a
eye has to be removed. Eyes have to be removed. The entire bone of the sinuses had to be. It is terrible if you don't let it treat early. So I have friends in Gangaram Hospital which they are saying that they have made a separate ward out of mucormycosis. There have been so many cases in Gangaram, being such a big hospital, that they had to make a separate ward for mucormycosis.
My God, that's just wow. Okay, Doc, following on, do you have a treatment for increasing immunity and lung strength? I think this is a common question, but specifically for lung strength and increasing immunity.
So again, exactly what do we mean by lung strength is what I need to understand. That again, if there is something that you have a problem of asthma or bronchitis and you have a weak expiratory or inspiratory, yes, we have. But again, as this is a COVID discussion, if you ask me, can I prevent a lung infection from happening in a COVID state? I have answered that query already, that if you come early, I can prevent it to a large extent, but not 100%. But if you, once the lung does get involved, then it is a problem.
Awesome, Doc. Doc, this is a common question actually. Shivani's raised it, but it's a very common question actually, Shiv. So thanks for bringing it up. Can homeopathy be combined with mainstream medicine, or is it one or the other? People get confused,
So, coincidentally, because there was so much of panic which was there, Bhavna, around a month back, so a lot of cases I have done combined with what they were already doing. So I have not dissuaded people of not using what they are using. But I just want to make a lot of people understand is that a lot of people started having a lot of antibiotics during COVID. Now, until and unless there is a high TLC count, which indicates a bacterial infection, I actually fail to understand the use of excessive use of antibiotics in a viral infection. In fact, that I feel may actually harm your immunity, as you are rightly using the word, more. So we'll have to be slightly careful in doing so. Although having said that, I did not dissuade anybody from using whatever they are using, because it did not hamper the effect of my medication. So the answer to your query is yes, we can do both the therapies together. There is no problem.
Okay, great. Doc, by the way, we've hit our time, but can you do a few more minutes? Can we continue with some audience questions? If it's
Please do, go ahead.
All right, thanks so much. From Rinky, pain near the sternum. What is that? Does that mean I still have mucus? What should I do?
So pain near the sternum actually, Rinky, means a lot of things. Maybe you may be having reflux. So what happens is, sometimes owing to the use of antibiotics and steroids, person develops a condition which is known as GERD, G-E-R-D, gastroesophageal reflux disease, owing to which the lower end of your esophagus gets inflamed and you start experiencing pain behind the sternum. We also call it the retrosternal pain. Now this is one of the common occurrence which we are seeing post-COVID, not because of the COVID per se, but because of the medicines which were used during COVID.
I see.
So it may not be related to your lung at all. It may be actually related to your esophagus inflammation owing to a reflux, owing to the use of medications which you have done during COVID.
That's amazing, Doc. So what should she do?
So basically, if once we diagnose it, what I'm saying is correct, she can use some medication in homeopathy. Like there is a medicine by the name of Iris versicolor. 30, which is used to take care of the reflux, which will take care of the lower end esophagus inflammation and also address the pain as well.
Awesome. Thank you, Doc. For Glossy, would you suggest something for children to protect them against the COVID infection, again, building their immunity? I know this has already been answered.
So again, kids or adults, it remains the same. Unfortunately, Glossy, we don't have enough studies with us as of now to basically ascertain that there is something which can be helped to prevent kids. You need to understand now that unfortunately in any science for that matter, we don't have a magic bullet as of now. We are just all trying. I am also, even after a year plus of COVID, year and a half of COVID, I'm still learning about it. Every day is a learning experience for me as well, because every day we find such varied types of symptoms, such varied type of people presenting with various type of problems. So it's a constant learning.
Absolutely. Like you rightly said, unless there's a white paper or some evidence, on what basis would you prescribe it?
I cannot prescribe something just on the hunch. It's like prescribing on a hunch. I am a medical doctor. I am not some palmistry doctor who can just think on a hunch. It has to be through some study. I have to have some study, some concrete evidence to start. And that is what I always urge all people to, before forwarding a message. And through this media, again, I want to insist on, before forwarding a message about a preventive or an oxygen increaser, please refer to your doctor. Don't forward it in groups. We have miserable time answering each and every person in those groups, because if somebody is going through a tough time and you heard a message, the first thing is they call us up and they ask that whether it is possible. Now, it is all right for me to answer, but you can imagine us receiving 300, 400 calls a day simply asking, is Spudospalma a good medicine for oxygen increasing? And to answer everybody with patience gets very taxing on us. So my suggestion to all of you is, please don't forward these messages until unless you get validated by somebody or some doctor who has shown you a white paper on that.
Very well said, Doc. So I think everybody just needs to don't forward unless you really get it, vetted. Okay, from Shibani, does Gelsium have a role to play as an antiviral? Also, does Bryonia help with the COVID cough?
So Gelsemium is a very good drug. I have found to be really effective in early viremia stage of viral. Yes, it has a massive role, and we have been using it for regular flu cases as well. But whether Gelsemium helps a lot of patients, my experience is that I have had a success of around 65 to 70% with Gelsemium. So around 65 to 70% people, if given Gelsemium at the right stage, have been helped at the early stage. But if you combine it with little bit of Hipasulf and Yabasenta, is when I have found that it covers and the proportion increases to around 80%.
Excellent.
So that is what. So in regards to Bryonia, it's a good drug for cough, but I have found Drosera to be a very good drug specifically for dry type of cough, and the normal symptom patient presents in COVID is basically a sensation of tightness in the chest with a sensation of something to be taken out of the chest, and the cough is not coming out. So that particular symptom, Drosera, has been found to be really working very well in a lot of my patients. Okay.
Doc, are there any basic meds you think we should keep at home, keeping in mind lockdown and, not easy accessibility to you?
So if you want, I have made a small first aid kit for my patients, not now, but for a long time. Even in the pre-COVID era, we have used this. So you can keep a small kit of around 15 medicines. If you want, we can forward you that kit in your group, and then you can just forward it to all of your viewers. So this kit of theirs basically are a group of 15 medicines. Once you have those medicines, it does cover you for your routine headaches, stomach pains, acidities, refluxes, low-grade fevers, cold cough, congestions, and little bit of that food poisoning and diarrhea and all those things.
Okay. And then with the consult, you should be okay. You'll be able to cover it. Okay. And Shibani is going to ask you specifically, what is the exact name, potency, and dosage of the particular combination you advise for COVID?
So I have found Gelsemium 30 Hipasol 30 and Yelbacenta mother tincture as the three medicines which we have used in the initial 1 to 3 stages of COVID, 1 to 3 days of COVID, and it has been found to be effective. But again, my suggestion would always be to consult your doctor and then do it. I always feel a doctor would be a better person to answer it, whether this combination would be fruitful. I am telling you my individual experience, and my individual experience may be different from another doctor's individual experience. But at the end of the day, these three medicines I have found have been effective. So Yelbacenta is a mother tincture. It comes in the form of a tincture. So 15 drops of that 4 times a day for any adult above 18.
Okay.
So not for kids. Kids, the dose differs. So for any adults above 18, this three medicines to be taken 4 times a day have been found to be really effective in preventing them to reaching to the cytokine storm in around 70 to 75 to 80% cases.
Awesome, Doc. Okay. From Anshu, we've got, this is a non-COVID case. So at the start, let me just say that. So she wakes up with phlegm sometimes, and she has a history of sinus and allergy. What do you recommend to take on a regular basis to help with this issue? She gargles, steams as well, and does run on a day.
So Anshu needs to understand that she seems to have a tendency to allergy. So this is allergic rhinitis. Honestly speaking, if it's a chronic problem, my suggestion to Anshu would be to consult a doctor and then take the medicine appropriately. Because in these cases, your symptoms and the elaboration of those symptoms matter a lot, and homeopathy works on those things. We actually don't work on a diagnostic point of view only. We work on a specific symptom. So your allergy may be very different from my allergies, how we consider, and that is what we use the word individualization. So if we individualize each patient and work accordingly. So my suggestion to Anshu would be that if you have a chronic allergic problem like a sinus allergy, it's better that you consult your doctor and take the medications appropriately to address this problem. The one good part is that in homeopathy, we have complete treatment and cure of these conditions.
Okay. Thanks very much, Doc. Preeti is saying, please can you give, again, can we just repeat the names of the three medicines to be used in the first 5 days, also the potency? She just wants to repeat.
Gelsemium 30.
Yeah. Gelsemium.
Hipasol 30. And Yelbacenta mother tincture. To be taken 4 times a day.
Okay. Awesome, Doc. Thanks very much. Okay, and Shivani has shared for everybody on the chat who's asking for doctor's coordinates. It's there on the chat. Doc, I've got a message here which is DM'd here. Please ask him what is the medication for pulmonary fibrosis post-COVID.
So post-COVID, if you're, again, we categorize the fibrosis into 3 categories: mild, moderate, and severe. So all 3 categories, we cater it differently. So in a case of mild fibrosis, a medicine by the name of Kali Carb 30 with Grindelia mother tincture is found to be effective. The moment we move to the moderate stage, then we add Antimtart and Blata mother tincture to the earlier 2 medicines.
Okay.
And in severe stages, it's difficult to advise one medication because it depends upon all the other factors as well. So in severe stages, it basically depends upon what symptoms the patients are presenting, and based on that, we need to understand. Here, I want to also point out that whether it's mild, moderate, or severe, the post-recovery in cases of COVID, and again, this is my personal experience, is very slow. It's very slow. You have to give it time. Nothing happens overnight. It takes minimum a week to 10 days before you start recovering out of it. And what my experience tells me that from the date of recovery, 1 month is what is typically required for you to actually come out of that stage in which you had developed a cytokine storm and there were some atypical pneumonia patches which you had developed.
Okay. Thanks, Doc, for that. We've got a quick question from Jyoti. Is there any homeopathic medicine you can suggest for post-viral asthenia?
So post-viral asthenia is again the tiredness, weakness, fatigue, lethargy, which we are talking about. So again, the use of alpha-alpha mother tincture has been found to be really effective in taking care of these weakness, lethargy, tiredness, and fatigue. And if there is an associated body pain, etc., adding a medicine by the name of Rustox 200 really helps.
Okay. All right, Doc. I think then we've got just one last, which is here. Homeopathy is very individualistic from Tanuja. Do you have to treat each patient differently? And is it helpful then to treat your regular patients so you know them well? Or do you think you can just treat, you know?
So in these COVID times, actually, to be very honest, I would love to have treated only my individual patients because those were known to me. But in this COVID times, I had treated a lot of patients. You will be surprised every day in that week, starting from second week of April to first week of May, I was nearly doing 20 to 25 to 30 cases per day of COVID of various stages. Certain I was advising them medicines. In certain cases, I was advising them hospitalization. Certain cases, I was asking them that I think they need to consult a allopath for steroids. So it was continuous thing. But yes, your viewer is right. Individually, if we understand a patient, it becomes so much easier for me to treat that patient. And that is how I have been able to manage lot of patients who were my earlier patients through only homeopathy in COVID. So I was so confident in helping them that through the COVID, other than an occasional use of crocin, I was able to manage them and we were able to pull them out without any pneumonia or any form of problems they didn't have.
That's amazing. And from Jyoti, she's just asking, this is the last question from the audience tonight. How much of alpha mother tincture, please? You just said that about the
So again, depends upon what is your weight. So for an adult, a safe value of 15 drops thrice a day should be enough.
Okay, great, Doc. Thank you so much. So now, Doc, I want to ask you on a personal level, how has it been for you? How has COVID been for you?
So it has been tough, Bhavna. It's been very tough. I have unfortunately lost a lot of patients in this COVID scenario. It has been tough when somebody is giving me a call at 10:30, 11 at night in the middle of the road, carrying his grandfather in the car with an oxygen of 65 and begging me to find a bed for me. It has been frustrating. It's been bad. It's been tough. There is so much anybody can do about it. People who are very well known to me, who are much younger to me, have died. So it's been very tough in that regard. It's been very tough in that regard. Every evening when I go home, I listen to one story, two stories. Somebody has had small kids have died. Somebody, mother and father both have died. So it's very tough. And the worst part is, as a doctor, we feel so helpless, and we feel that why God didn't give us more information and more knowledge to help them. But unfortunately, this disease has been such that the understanding has been so limited with us that we can't do much. In lot of cases, it keeps on surprising us every day. Every day we feel that we have known little bit, and the next day we feel we know nothing. So it's been a very up and down story with me. I don't know what others doctors feels, but personally speaking, I feel every day there has been so much information, so much knowledge which we need to learn. We feel 24 hours are less, but that's how it is.
Doc, I'm just going to ask you before I close this, but tell me, so what do you think about a third wave? I mean, you know, it's upon us, and are we better prepared?
So my take on that is that this virus, or for that matter, any viral infection follows a sine wave. So a sine wave is a S wave. So it moves up, it moves down, it moves up, it moves down. So it follows a sine wave. So a third wave is inevitable as per me. It is bound to come. Now, what would be the severity would depend upon lot of factors. Definitely, the second wave has been a huge learning experience for all of us. It has been a huge experience for doctor fraternity as well as for the healthcare fraternity, as well as I think and I hope for the bureaucratic fraternity as well.
Yeah.
Lot of lessons are learned. So once we learn these lessons and we hope that we remember these lessons, we can to an extent dull the extent of the third wave. The best part which we need to understand is that we need to understand, one, the second wave has not ended. So don't rejoice too quickly. There is still, we are the largest, we are the country which is still producing the maximum number of cases of COVID in the world as of now, and we
Yeah.
are way off mark. So we are nearly 2 lakh plus still. The next country is, I think, a Brazil or a US, which is practically a 17,000 or a 20,000 type of thing which is happening. So the difference is huge. So my suggestion is not to rejoice too quickly and take it very slowly still. That's one. And the second and the most important part is to also understand that once the wave does subside, we need to carry our basic things of wearing a mask, maintaining hygiene, maintaining social distancing. I think
Yeah.
that is what is finally going to help. And there is absolutely, and through this media, I also want to say that all of you must vaccinate. Everybody must vaccinate. There is absolutely no choice. Don't go into this that we'll wait for Pfizer or we'll wait for Moderna or we'll wait for Johnson and Johnson or we will wait for Sputnik. Don't do that. Whatever is available, wherever is available, please take the vaccine. I also insist upon young kids. I think they have to travel abroad, and there is lot of talk about the fact that Covaxin is not approved by WHO and Covishield is approved. So somebody must put Covishield only. Please understand, whatever is available, please put it, because our first scenario is to protect yourself. Education can wait, studies can wait, everything can wait. But the best important part is we need to, as a country, fight it out and prevent the third wave from coming in a big way, because the loss has been huge. Don't go by the figures alone. The deaths have been, as per me, much, much more. Everybody has lost somebody known to them. I have yet to find a person who can tell me that he has not lost anybody, one of his friends or a relative or an extended family. Somebody has lost somebody in this wave. We don't want another such wave to happen.
You are so right, Doc. No, really, absolutely. Doc, for all you do and for all your wisdom and for all your experience and for coming on this platform, I am so, so grateful to you.
Thank you, Bhavna. Thank you for having me here. I hope your viewers must have heard something and probably have understood a little bit what I have, little bit of knowledge about it. The important part is that everybody needs to understand that this is a virus which we have this much knowledge and we need this much knowledge.
Absolutely.
So there is very little anybody knows about it. Every day is a learning experience. Don't think you are above the virus.
Nobody is invincible.
Nobody is invincible. Nobody is above the virus. It's a nasty virus. It's a really nasty virus. It can strike back at any time. We have had, and I want to put a spoiler here. I know the session is ending, but I need to put a spoiler here.
Please.
I have had a case which has had a recurrence within 2 months.
Yeah.
So there was lot of this talk about the fact that before 3.5 months we are safe. It's not going to happen. I've had
antibodies.
Antibodies are formed, and there is again there is another very interesting thing that a lot of people check their antibodies and say that we are safe. Who will decide what is an enough antibody?
True, Doc. Absolutely.
Who will decide that? What is, whether a 50 is enough or a 250 is enough? Who decides that?
Right. No, absolutely, Doc. Thank you so much. It's really been a brilliant session engaging with you. You are fabulous, and really sharing your wisdom with everybody. Thank you so much. And I love what you said. You know, if it's not evidence based, I'm not giving it. That's really wonderful, Doc. Thank you so much.
Thank you, Bhavna. Thank you for having me here. Thank you.
Thanks very much for coming on CII IWN's Need of the Hour. Please do join us tomorrow. We have Dr. Matthew Verghese, who is consultant at St. Stephen's Hospital. On Monday, we have Miss Vinita Uppal. She's director at the British School. And then on Tuesday, we have Sister Shivani from Brahmakumaris. And that's the last day Need of the Hour will be live. So look forward to everybody joining us, and thank you very much. See you tomorrow.